Today, there are over 40 million men and women aged 65 and beyond. By 2020, that number is forecast to reach nearly 55 million, and by 2030, this population will exceed 73 million. As we age, certain ailments become more common. Medicare reports that strokes cost $36,000 per incident, COPD over $31,000, heart failure over $34,000, and AFib over $29,000 per incident. While we can't wait for loved ones to be discharged from the hospitals, the readmission rates for these conditions are reported to be between 20 to 26%. That means that as many as 1 in 4 people admitted return to the hospital. 1 in 4. Wow. Let's boil this down. Our healthcare system has a missing piece, a mechanism that connects compliance, or lack of it, back to the healthcare providers. What happens when our loved ones are discharged from the hospital? More often than not, they go home, back to their routines, back to protecting their independence, and all too often back to non-compliance. There is a gap in compliance, information, and intervention. But there is a solution. SentinelCALL and SentinelCONNECT were developed to bridge the gap and shine a light into that blind spot. Using just a telephone, critical information, including patient-reported measures, is collected once or twice a day, the results automatically evaluated, flagged, and reported back to the healthcare providers. SentinelCONNECT changes the old reactive model into a proactive approach, keeping doctors and nurses informed and able to reach out to those patients who need their attention. SentinelCALL and SentinelCONNECT offer engagement for the families through use of free iPhone and Android apps. And what about the cost? As little as 88 cents per day for these chronic condition management services, which fall under Medicare's existing care programs. And what if there is something found? Medicare has programs that pay providers for ongoing care. So if Aunt Jane needs a little more help, programs such as medication therapy management are there providing one-on-one engagement. SentinelCALL and SentinelCONNECT provide the missing link, paving the way for increased engagement, compliance, and better health outcomes.